Coming up, we'll be on location at your Community Smile in Lansdowne, Virginia, discussing the latest advances in dentistry and how they can help improve your oral health and give you that beautiful smile you've always desired with one of this area's top dentists, Dr. Narjes Abtahi. Welcome, Dr. Abtahi, to the Top Doctors Interviews program.
Well, thank you for coming, and we're looking forward to that.
All right, we've got a lot to talk about. There's been so many advances in dentistry that we're going to touch on, some of the key treatments that you offer. Mm-hmm. But before we do, I wanted to touch on the fact that you're recognized as a top dentist throughout Loudoun County. You've been helping patients improve their oral health, get beautiful smiles, not only for your patients, but their families as well. We spoke to some of your patients, and they were ecstatic. They were glowing about how well you take care of them. So I wanted to begin by asking you, Dr. Abtahi, about your vision for your practice.
At your Community Smile, we are dedicated to helping patients to obtain their maximum potential for their good oral health by providing high quality and affordable dentistry in a very relaxing environment and with a soft touch.
That's wonderful, Dr. Abtahi. I love the approach. You know, the relaxing environment is very important because a lot of patients get dental anxiety going into a dentist's office from maybe an experience they had as children, or it's one of the fears of many people. So when you can come in and you have a dentist that really listens and works with the patient like yourself and has a very calming environment, it provides for a much better experience for each patient. Now, I wanted to get into the advances in dentistry. There's been quite a few. Can you tell us about some of the key treatments and advances that you offer here at your practice?
We offer a variety of treatments, starting from very basic of, cleaning, whitening, fillings and crowns, bridges, dentures, and orthodontic treatment, and also implant placement and restoration, which I'm very excited about.
So you really are like almost a one-stop shop.
Yes.
Where whatever the dental needs are, you can address them here, and you've got the training and the experience to provide great results for those patients.
Yes, we definitely do, and we try our best to provide the best quality care for patients.
Invisalign is an advancement that we hear about a lot. We see commercials on TV. Many people don't know exactly how it works. Can you tell us more about Invisalign, what it is and how it does work?
Well, with Invisalign, of course, they're beginning with the good treatment plan, and when we see the patient, we see if the patient needs any orthodontic treatment to begin with. If so, we have several scanning equipment that we can just easily scan patient's mouth instead of taking impression and be kind of messy impressions and all that. So we take a scan of the patient, and then I work with that on the software to try to move the teeth the way that they're supposed to be. And after the completion of that process, all the aligners, it's made and shipped here from Align Company, and then we'll just start delivering those to patients and going over the instructions, how they do and all that. And so it's pretty straightforward and very easy for patients. I used to do braces as well for several years, but I found out that Invisalign is much easier for patients and prevents a lot of problems that the regular braces would bring, such as root resorption, a lot of caries if they don't take care of the good, if they don't have any good hygiene, they would get a lot of cavities around, the brackets, and of course discomfort, and they cannot, eat their normal food, their regular food, because certain things they cannot eat. With Invisalign, they remove the aligners, they eat whatever they like to eat, they can brush, floss easily like always, and then they put them back on. And they wear them for a good number of hours during the day and night until the treatment is done.
Is everyone a candidate that uses braces a candidate for Invisalign, or are there certain restrictions?
With the advanced technology of their software, the Align Company, right now we can do a lot of difficult cases that before we were not able to. with Invisalign, and we can only do with braces, but most cases we can definitely treat them with Invisalign. If they have a skeletal problem, they might need surgery to correct that. So, but other than that, everything else can be pretty much done with Invisalign.
Dr. Abtahi, you also do dental implants as well. Can you tell us more about that?
I'm very excited about that because before the technology was more advanced, we would do like freehand implant placement, which can create more stress and all that. But now with the advanced technology and the CBCT or the 3D imaging, we're able to treatment plan that beforehand. So I normally, after I obtain the 3D image, I treatment plan it on the software. I know where to put the implant, what size I need to use and all that. So when the patient is here for actual procedure, it's just as straightforward. It's, and I usually use, surgical guide, so that makes it much easier and faster. Patients have a lot of good result with that, and they're very happy about the process.
That's amazing. The advancement in technology takes all the guesswork out of it.
Yes.
Now
exactly.
you have the guide, surgical guide, so you know exactly where to place the implants, and it really creates much better results and experiences for the patients.
Yes, definitely. And they're very satisfied.
So how long do the implants take to actually place, where someone can come in, get the evaluation, and then have the new teeth?
One-side treatment plan, which can be just a few days, and then I can have the patient ready come in. And by that time, when I have the surgical guide ready to go, and then so depending on the number of implants we place, if it's like one or something, it shouldn't take that long, so it would go pretty quick. And then after the implant is placed, we usually wait a few months for the integration of the bone and the stability of the implant, and then we can restore it with implant crowns.
And are they like your natural teeth? Do they last as long, or how does that work?
If the patients take care of the implants just like natural teeth, so they still need to brush, floss around them, keep them clean, and they need to come in for their visits for 6 months, recalls and any follow-ups, because it's important to just keep an eye on them. But once they take care of them well, they can last a long time.
Great option that can help so many people, Dr. Abtahi, because whether they're missing a single tooth or multiple teeth, there's millions of people that are suffering from tooth loss, and dental implants are a great option for those
Exactly.
people.
Yes, there are several options. They can just restore from 1 or 2 teeth in the missing. They can do dentures that go over the implant, or they can do fixed options that, like for the whole jaw, and it stays in, so they can function better. They can chew without any problem and all that. So there are a variety of options for patients with different needs.
And you also have some great advanced technology here at your practice, your community, Smile. You have CEREC, which is a great technology because you can do crowns literally here in your office instead of going out to a lab.
Yeah.
Can you tell us more about that?
Sure. We are able to just scan the patients after the tooth is prepped. We scan the area, and I design it on the computer, and I have milling machine that we can mill it in the office. So a lot of times we can do like on the same day crown deliveries. If they cannot stay in the office, let's say for that to be processed, we give them temporary crowns, and they come back in a few days, and they can get their crown cemented in. And with that, we normally do single crowns, we can do multiple crowns, we can do bridges, and we can also do implant crowns, which I'm very excited about.
You're doing a lot of great, exciting work here with all these advances. They're like your new toys. You're very excited, and your patients are getting great results as well. So
yes, I really like technology, and I like to be up with that. So whenever something new comes up, I like to give it a try. And
Dr. Abtahi, what other treatments do you offer here at your practice?
Basically, as I mentioned before, we do a lot of services, from anywhere from cleaning to dentures, orthodontic implants, and root canals. We also provide, that service for the patients. Also, we refer to a specialist as needed. We are also providing emergency visits for patients. We always get patients in on the same day. And if they need any treatment, if you're able to do that within that time, we'll do, such as root canal. A lot of times patients come in with pain, and we can take them out of pain by doing the root canal. And later on, if it needs to be, we can refer to a specialist, but we get them comfortable enough to be able to treat them further.
Well, Dr. Abtahi, you're literally, as I mentioned earlier, a one-stop shop. You do everything here. As you mentioned, root canals, dental implants, cosmetic dentistry, teeth whitening, anything that needs to be done. And then you work with great specialists. If you ever have to refer someone out, you can do that as well. Well, Dr. Abtahi, that was very informative. It was great coming out to your wonderful practice here, your community Smile.
You.
Keep doing the great work, and thank you for being a guest on our program.
Well, thank you very much for coming and giving us this opportunity to explain our services to patients.
I had braces as a teenager, and then after having children, they moved, and probably losing my retainer over the years, I needed to get them straightened again. And so I came in for just a routine cleaning and ended up loving her and using her to do Invisalign. She explained everything each time I had to come back to get a new tray, and it was a seamless process. And I felt very pleased with the outcome. My teeth were very well aligned, and I was very grateful for the process. Dr. Abtahi is like a one-stop shop for my family. My husband has come, and my children have all come, and my husband had implants, and I've had a crown over the years, and my children have come with their cavities. She's been wonderful working with all of us. She's always been very accommodating, and she's a mother, and she understands children. We've been very thrilled as a family.
I had crown issues, I had a broken tooth, and I needed my teeth to be aligned. The problem caused me not to be able to grind up my food properly when chewing because I was missing a couple of teeth and a couple of cracks. So the result of getting the Invisalign and getting the process done resulted in much better breaking down of my food and much better digestion. I had Invisalign, I had cleanings, crown work, and I believe we had a root canal done as well. They've improved the digestion process. My teeth feel a lot better. They feel healthier, they're stronger. I can just say that it's been a great experience getting the dental work done. I highly recommend Dr. Abtahi and Community Smile for the following reasons. She takes time, she cares about the patients, she tells you what she's doing before she does it, so there are no surprises as she makes those moves. No real pain. I am totally happy with the results. My smile is getting better every week, every month. The doctor's done a wonderful job.